How long should be my abstinence before I give sperm? And that's a very common question that is asked. Let's look at the background. The background is that optimal abstinence period before semen sample is debatable. WHO recommends a minimum of 2 days abstinence before an ART procedure. Longer abstinence is believed to improve sperm volume but does not seem to improve clinical outcomes. Shorter abstinence period may improve DNA fragmentation and fertilization rates. So, what is the objective of this study? And the objective was to evaluate the impact of less than 2 days of abstinence on embryogenesis and pregnancy outcome in a fresh embryo transfer. And that's in a frozen embryo transfer. So let's look at the materials and methods. The design is a retrospective study, academic setting, patients 2,979 who cycles with 1,824. Intervention was an abstinence period of less than 2 days and those of 2 or more days. Outcomes were calculated as number of high quality blastocysts, conversion PNs, and clinical pregnancy rates. The results were an abstinence periods range from 0.5 to 31 days, a mean of 3 days. 131 cycles had abstinence period of less than 2 days. No significant differences in baseline characteristics between the two groups. Fertilization rates were similar. In less than 2 days, that's 78.8%, and more than 2 days, 78.3%. No significant differences were seen in number and conversion of day 5 and day 6 blastocysts between the two groups. There seems to be a non-significant increase in positive pregnancy and clinical pregnancy rates with abstinence of less than 2 days. The adjusted results were not significant. And in conclusion, we would say that an abstinence period of less than 2 days does not negatively impact with embryogenesis or pregnancy rates. Potentially, there is a clinically significant increase in pregnancy rates with shorter outcome. The findings suggest re-evaluating the WHO guidelines on abstinence periods, and future studies should include more randomized controlled trials. In summary, we would say that the new study suggests shorter abstinence intervals of less than 2 days before a semen sample production may not negatively impact IVF outcomes.